Hello, everyone, and thank you so much for joining us. This is Georgie Carter from the Health Policy Plus project. I am delighted to welcome you to today's online policy forum entitled A Multisectoral Endeavor Called Health, Working Across Sectors for Quality and Sustainability. We have a great discussion lined up for you today, and we'll begin with just a few announcements. Now, this session is being recorded, and we will post the recording to the Health Policy Plus website. We would love to hear from you, and we welcome your questions at any time. Please submit your questions via the chat box on the right side of your screen, and our moderator will read them aloud when we pause for questions. Now, these web conferencing platforms are getting a high volume of traffic these days, so we ask that you bear with us just in case there are any glitches with the technology. And finally, we ask that if you are not speaking, please mute yourself to keep the line nice and quiet while others are talking. Now, that concludes our announcements portion, and it is my pleasure to hand it over to my colleague, Jay Gribble, the Deputy Director for Family Planning and Reproductive Health for the Health Policy Plus project. Jay?
Thank you, Georgie. Hello, everybody, and welcome to our webinar on multisectoral actions. Multisectoral actions for health are the coming together of the health and non-health sectors to improve the health of a population. While focusing on health outcomes, they can also address social and economic factors that influence the health of a population at the local, national, and global levels. They have the potential to play an important role in improving health, expanding beyond the health sector, which is often very focused on the delivery of healthcare services. As a result, the potential of multisectoral collaboration in many settings remains untapped or underutilized. Different sectors make different contributions in solving specific health problems. In each case, and in the examples we'll hear about today, we can see the importance of mapping and analyzing the profiles, the interests and incentives and relationships of key individuals and sectors that are engaged in designing a specific multisectoral action and developing the needed systems to tackle a shared problem. Multisectoral endeavors aren't just a set of random efforts. They are designed to focus efforts on achieving a common goal. They illustrate the need to reach outside our comfort zones and work in a variety of collaborative and coordinated ways to achieve improved health outcomes. The Health Policy Plus project published a blog series on multisectoral actions that were designed to give examples of how they operate and what it takes for them to work successfully. Some of the lessons from MSAs align with other aspects of policy work. For example, the importance of understanding the context, the need to have good communications, and the role of stakeholder engagement. The complex problems that are the focus of MSAs need to be broken down into manageable pieces that have a combination of both long-term and short-term solutions. I'm pleased to introduce our panels today. First, we've got Clive Mutunga, Senior Technical Advisor from the Office of Population at USAID. We've got Katie Vickland, Director of Youth and Workforce Development at Palladium. Joni Waldron, Director of Communications for the USAID-supported Agricultural Diversification Project in Malawi, which is implemented by Palladium. Sayaka Koseki, who is the technical lead for private sector on the Health Policy Plus project, working with Palladium, and Allison Lipsky, technical lead for stewardship, accountability, and transparency with HP Plus, working with RTI International. So our agenda will be in the order of the panelists that I've just mentioned. We have the introduction. We'll start with Clive, sharing some perspectives from USAID. Then we'll move to Katie talking about integrated youth development. Joni will talk about addressing underlying causes of malnutrition. Sayaka will speak about public and private sector collaboration. Allison will speak about laying a foundation for success with governance approaches with MSAs. We'll have a short roundtable discussion among the participants, and then we'll open it up for question and answers. As Georgie said, if you have questions at any time, put them into the chat area and we'll get back to you. We look forward to your participation. And so now I'll turn it over to Clive. Thank you.
Thank you, Jay, and thank you, Palladium and HP Plus Project for organizing this session and for inviting me to talk about a topic that is dear to me. So, multi-sector approaches and how these can be leveraged upon to deliver both health and non-health outcomes. Just to get started, I go back to our common future, where the three pillars of sustainable development were articulated. These are the economic, the social, and the environmental pillars. And we know that the health-related goals and indicators within that framework, which later informed the Millennium Development Goals and later the Sustainable Development Goals, are much in the social sector. But we make the point that health issues and health goals are not only health issues, but they cut across the other development indicators and sectors, namely the environment and the economy. We know that long-term sustainability requires acknowledging that many of these sectors are interrelated. Of course, we know that humans don't live their life in silos. Every decision they make is linked to whatever actions that they have to deal with. And development can only be sustainable if it works within those constraints over time, across sectors and locations. This is where some of the development approaches fell short because they only identified sectoral goals and targets under them with little consideration of our efforts to attain a goal in one sector would be affected by efforts in another sector. And this is where commentators have said that the Sustainable Development Goals at least made an attempt to link the various development sectors. Within the Office of Population and Reproductive Health, and generally within USAID, we believe that cross-sectoral approaches are critical for development. The Office of Population and Reproductive Health, for instance, believes that and understands that population and family planning matter for virtually all development issues and sectors, and that strategic cross-sectoral integrated programming can effectively support the achievement of family planning and reproductive outcomes and objectives. But at the same time, this will contribute to the accomplishment of multiple other development sector outcomes. So we've a body of work that supports cross-sector coordination for integrating population and family plans into plans, policies, and programs of the various development sectors, including environment and climate change, economic growth, livelihoods, food and water security, education, peace and stability, and resilience. Of course, these are all underpinned by very critical cross-cutting issues around youth, and we, of course, pay into a lot of attention the principle of positive youth development, which you'll hear a lot later. We promote gender and we promote equity, and then we ensure all these cross-sector integrated also recognize the important role that private sector engagement plays, and we will hear specific examples about all of those in a while. And why do we do cross-sectoral or multi-sectoral integration, and why is policy around it critical? We've seen that over the work that the office has done for the close to 3 decades now, in that there are various benefits of that. For instance, we've seen that through a number of evaluation and research of some of the activities that there are improvements in indicators that are beyond achievements that will be possible in single sector projects. So you're able to see increase, for instance, in contraceptive use in way beyond what you would get in a siloed family planning or reproductive health project. We've also seen that some of these, because you are leveraging on other sector platforms, you are able actually to address some critical equity issues and being able to deliver health information and services in very remote and underserved areas. And you see in some of the platforms that are the sectors, for instance, the agriculture and conservation sectors are already putting in place. So we've also seen the increased participation and involvement of females in conservation, natural resource, and then economic growth activities. In most places, those type of activities have been reserved for males, so very important gender considerations into place. On the other side, we've seen greater involvement of men and boys in health and family planning, for instance, and of course being very big supporters of that. Some of the evaluations have also shown that these activities, of course, are more effective than single sector efforts, and they are able to save organizations and communities time, which not only increases greater buy-in from communities and more rapid mobilization of community efforts, but it also leads to quicker results. But at the end of the day, we realize that these cross-sectoral approaches are actually recognized by national development and sectoral plans. We are looking at a number of the long-term sector development plans across the many countries that we work in. You realize that these longer-term development sectors call for cross-sectoral or multi-sectoral integration. You look at some of the specific sector plans and strategy documents. For instance, a nutrition policy, it talks about multisectoral. So there is always, most of these sector plans and strategies recognize the links. What remains the biggest challenge is really linking that policy recognition to policy and program action. And this is where we really talk about the importance to strengthen health policy and sustainability, because being able to ensure that this recognition is translated into policy and program action requires policy advocacy and negotiation and communication to ensure that this gets to policymakers and they are able to translate this to high levels of financial and political commitment. That's the end of my remarks. Looking forward to having the chat at the end of the session. Thank you very much. Over to you, Jay.
Thanks so much, Clive. Really appreciate your insights into not only multisectoral approaches, but cross-sectoral, why USAID takes this approach, and giving some examples of how they are contributing to better health outcomes. Really appreciate your insights. Turn it over to Katie Bicklin, who'll talk about youth. Thanks, Katie.
Thank you so much, Jay and Clive. As we strengthen health policy and sustainability, it's so important that we intentionally engage with youth in order to understand and address their integrated needs. As Clive emphasized, people don't live in silos. So Palladium's Youth Yes Youth Empowerment strategy depicts that youth can make successful transitions to adulthood with access to health and community, skills, opportunities, and finance to take advantage of those opportunities, build their business, prepare for a formal job. Multisectoral actions enhance outcomes. So for example, increasing skills can lead to better jobs and higher incomes, resulting in health benefits not only for the individuals, but even for their children as well. And at the same time, we know that better access to family planning services is going to increase retention and graduation in skill building programs, which then opens doors for higher incomes, reducing poverty. So to improve these outcomes, it's important to take a systems approach to improve the quality of and access to youth services. Activities that build the local capacity to connect youth to relevant services will make a lasting system for supporting youth. So in our experience, The 3 blue bullets on the left highlight core elements of multisectoral action success. First, MSA requires a sustained political commitment to service delivery. A policy is foundational, but it's not enough. As Clive highlighted, we need to translate the policy into action. Second, we need to coordinate across sectors. And here we want to highlight the key roles of a variety of coordination mechanisms. We can coordinate through individuals, through their families, through mentors, through case managers, through co-locating services. So there's a number of exciting mechanisms for coordinating across sectors. And thirdly, we must authentically engage with youth to implement effective youth programs. As the saying goes, do nothing for youth without youth. So let's bring the conversation down from the conceptual to some practical examples of multisectoral actions through integrated youth development. So for example, in Guatemala, HP Plus works across sectors, keeping health, but also nutrition and education at the top of the local and national policy agendas. HP Plus engages in two-way dialogue with 2 leading youth groups to ensure that youth views and priorities are incorporated into activities and provide advocacy and empowerment training for youth. The advocacy campaigns encourage youth to vote, as well as encourage candidates to support youth policies. Great example of multisectoral action. A second example is the Palladium implemented DFID-funded adolescent reproductive health program in Ghana. It spurred an 84% increase in new users of modern family planning methods among youth and a decline in adolescent pregnancy. MSA was key to the success. The program mainstreamed health services into schools and community organizations serving out of school youth. The program created more than 500 school health clubs. So co-locating the services assisted youth and their families to simultaneously address their health and education goals. So why is MSA untapped and underutilized, as Jay mentioned at the outset of this panel? Why don't we see MSA more often? Well, donor funding cycles and planning cycles need to align, and stakeholders need to be able to speak the languages of the various stakeholders in order to pursue these win-win partnerships. But we know that MSA is feasible and it has impact, and it should be sought wherever possible. I'd like to pass the presentation to my colleague, Joni Waldron.
Thank you so much, Katie. I'm so pleased to be able to join this conversation today about the importance of multisectoral collaboration, specifically how involving different sectors in nutrition programming can help to improve health outcomes. Programs that address malnutrition often focus on the immediate causes of malnutrition, addressing clinical needs of women and children, through interventions such as food fortification, support for breastfeeding, and micronutrient supplementation. Yet the underlying causes of malnutrition are often far more complex. The high prevalence of household food insecurity highlights the need to link traditional nutritional approaches with complementary interventions in sectors such as agriculture and finance to increase the accessibility of affordable, nutrient-dense foods. The emerging field of nutrition-sensitive agriculture advocates for this type of multisectoral approach, in which the objectives of agricultural programming include improvements to both health and nutrition. Nutrition-sensitive agriculture recognizes that for program participants, health and economic outcomes are linked. Additional income from agricultural production and agri-linked businesses allows farming households to increase their dietary diversity and provides more disposable income to spend on healthcare needs. The Feed the Future Malawi Ag Diversification Activity, or AGDIV for short, takes a systems approach to reducing poverty and malnutrition. We work with a wide range of partners, including large-scale commercial agriculture, financial institutions, U.S. universities, and government partners, recognizing that each has unique contributions to the growth and resilience of market systems, creating new pathways for smallholder farmers to increase their incomes. Through this approach, we view project beneficiaries as clients, active participants in the larger market system, whose decisions and choices are influenced by barriers and opportunities in agriculture, education, governance, and health sectors. Seeing our clients as part of the market system helps to build sustainability into our nutrition interventions, which are selected due to their potential for improving both nutrition and incomes. This creates an incentive for the client to continue implementation and even expand the intervention independently beyond the lifetime of the project. One of AGDIV's most successful interventions to improve nutrition is the introduction of soy kits, a simple, low-cost technology that offers a profitable, flexible, entrepreneurial opportunity for women, while also creating a highly nutritious product to benefit vulnerable populations. At a cost of $80, the soy kit turns soybeans, which are already locally produced by many Malawians as a cash crop, into soy milk and a residual mash called okara. AGDIV provides the soy kit either on loan or as an in-kind grant and layers it with other interventions to improve soybean production and post-harvest storage. From the initial pilot with just 13 women 3 years ago, AGDIV expects to have more than 4,000 entrepreneurs in operation by the end of this year, with a potential market of thousands more, providing an affordable and locally available source of protein energy in many local communities. Women like Emelita Mponda, a subsistence farmer from Mchinji district, are using the soy kit to produce an average of 10 liters of soy milk a day, earning nearly $100 a month, selling soy milk and soy-based snacks to neighbors and children attending local primary schools. These products provide a more nutritious alternative to the flavored juice drinks and fritters that are ubiquitous. And the local health center now tells families in the area whose children are falling behind on growth metrics to try providing them with Emelita's soy milk. Interventions like soy kits are successful because entrepreneurs can see both the health and the economic benefit. Emelita is able to earn profits that are significantly changing her income level. In addition to consuming the soy products at home, the soy milk business has provided her with enough additional income to invest in fertilizers that improve the productivity of her crops, build an outdoor latrine that improves sanitation, and provide vitamin-fortified porridge to feed her grandson who lives with her. There's no easy solution to reducing malnutrition. It's a complex problem that is linked to food insecurity, poverty, and cultural and social norms and behaviors. But by taking a step back and considering the links between agriculture, food security, income, and women's empowerment, projects like AGDIV are addressing these interrelated issues, leading to sustainable solutions and positive impact for rural agricultural communities around the world. I'm now pleased to introduce Sayaka Koseki, who will be speaking about public and private sector collaboration.
Thank you so much, Joni. It's been really interesting to hear perspectives on multisectoral action as we compare health sector to other adjacent relevant sectors from Joni and Kenny. You might have heard the relevance of private sector engagement and market-based approaches in contributing to public health goals. So leading on that theme, I'm going to speak about the collaboration among the various institutions that make up the public and the private health sectors. So private sector engagement has been elevated in recent years as critical to the overall health system. The government has the overall stewardship role to ensure that the public health goals are prioritized, strategies to achieve them are created, and to engage the key players instrumental in executing that strategy. And while certain parts of the private sector, such as faith-based organizations, civil society organizations, or social marketing organizations may have been engaged in these processes in the past, what is important now is that there is recognition that without the whole private sector, and I use that term in the broadest sense, from nonprofit to for-profit, providers, pharmaceutical companies, distributors, as well as employers and insurance, financial institutions, to name a few, all these players are needed for successful development and execution of the health strategy. So why is that? Why are we coming to this recognition now and appreciation? I think, you know, there is much more recognition now that we all live in a mixed health system, and with a push towards more sustainability, resilience, and self-sufficiency in many countries, leveraging the private sector is critical to more efficiently and effectively provide healthcare. So that said, I see that most countries are still nascent in this private sector engagement process. There's still a lot of skepticism between the two sectors, such as public sector second-guessing private sector's genuine interest in contributing to the public health goals as strictly profit-seeking, or private sector fearing engagement as lead-in to over-regulation. The work that Health Policy Project, as well as others that I have seen or have had the pleasure of being involved in, has shown that establishing a policy framework co-created through multisectoral collaboration can be a great way to systematize consistent conversation across these two sectors. With a strong policy engagement process, a policy framework can actually lead to policy implementation. You really want to go from, things on paper that's kind of proclaimed to actual action. And I don't think we need to jump to big projects with huge resources invested to the start. Simple partnerships with mutual interest and intention to learn from that process about each other and how the two sectors can continue to improve their collaborative relationship is really helpful. So for example, in Liberia, the Health Policy Plus project with the government of Liberia and the Liberia Healthcare Federation rolled out a web-based infection prevention training for private providers. And this was time when COVID was starting to emerge, come into sub-Saharan Africa. So this was a really critical tool for the government and the providers to make sure that they had the best skills to equip themselves with the limited resources that they have. It certainly isn't a very elaborate project or an elaborate partnership, collaboration, or anything like that, but certainly it was a good way to show on both sides how they can mutually work together and create a win-win scenario. So ongoing investment into these types of discrete engagement and collaboration, often catalyzed through mutual interest and needs, can pave the way for long-term, sustained, multisectoral approach to achieving healthcare goals. So with that, now I want to pass it on to Allison Lipsky, who will to governance approaches to MSA.
Thanks, Sayaka. And I'm turning on my video quickly to say hello. My internet has been slow this morning, so I'm going to turn it off now that I've said hi and you can see my face. I think, Clive, Katie, Joni, Sayaka, and Jay did such a nice job explaining the importance of MSAs for health and the great benefits that can come from different types of multisectoral activities. And from a governance perspective, I think that the most fundamental challenge that any MSA faces is that silos within and between the government, public, and private sectors will always exist. And despite Clive and Katie acknowledging and Joni acknowledging that people don't live in silos, these silos in the government and private sector and all these different technical sectors are never going to go away. Therefore, we need to have a toolbox with multiple different approaches to effectively work across those silos for MSAs when needed. And the tools we use need to address the significant challenges for motivation and accountability that come with MSAs. And some key issues that we've heard alluded to today include cultivating and sustaining political will at high levels of government, and having that high level political support can mitigate both the motivation and accountability challenges. When a president or prime minister is following progress on a multisectoral activity, folks are more likely to make sure they do their part. For example, in the 1990s, many countries established HIV and AIDS committees that sat within the president's or prime minister's office. And with that came the weight needed to ensure different ministries, organizations, stakeholders came together, paid attention, and prioritized HIV and AIDS within their own work. This can also lead to creative institutional solutions. Often there needs to be a new task force or a committee for an emerging issue or leveraging of an existing platform. Think of all the COVID task forces that have been established over the last year. These span health, finance and economics, labor, international relations, education, agriculture, private sector, etc. And a key function of these institutional arrangements is to provide a vibrant communication platform, ensuring that everyone is effectively communicating progress, challenges, or simply checking in. To ensure accountability, there needs to be agreement on milestones and shared metrics, as well as sector-specific metrics to ensure compliance with joint plans. For example, while malnutrition can and should be tackled from the health and education sectors as well as others, and they can generally agree on an ideal outcome, for example, reducing stunting by a certain percentage, the indicators that need to be tracked in each sector are different and should be different. And of course, we can't forget the resources. And we need to think of this broadly. It's not just money, but also the right people with the right skill sets in the right places to affect change and advance the issue. The silos here can be difficult to overcome. Funding has to go through the silos. People sit in certain places and have certain types of expertise. So how do you find or cultivate the champions who are going to push even if they don't have a big funding envelope? And how do you develop the capacity to facilitate MSAs? And these are some of the major governance considerations when undertaking MSAs. Doing something about these considerations is more challenging than talking about them, and often relies on the political and economic context. Who has the authority, influence, and/or power to help support the MSA? And based in this context, it's important to invest the time to identify and effectively communicate the win-win scenario. Being inclusive throughout the whole process, beginning with problem identification, can help make sure that you're getting the perspective and speaking the language of other sectors from the beginning. It's also important to be realistic about available and needed resources from the beginning so that you don't get into a situation where you're over-promising. Knowing what you have on hand and what you can realistically advocate for can help ensure you can achieve the plans that are defined. Finally, be creative with institutional arrangements. Perhaps an ad hoc task force will work, or perhaps it makes sense to loan or second someone from one agency to another, or from one team to another, or perhaps it makes sense to contract out the coordination function. Ultimately, MSAs rely on effective knowledge of the country context, innovation and creativity to find those unique connections between silos, and commitment and passion to keep the fires burning. Thanks so much, and at this point, I'll pass it back to Jay.
Thanks, Allison. So we've heard some examples: youth, malnutrition. We've heard about working with the private sector. We've heard about governance. So why didn't everybody turn on their camera, the panelists, and we can have a roundtable discussion. And I'm happy to kick it off with a few questions. So while political will is a critical ingredient for MSAs, and implementation of MSAs comes down to bureaucrats or technical experts or industry leaders, understanding these actors' insights and perspectives to meaningfully commit when the potential benefit is very clear is just common sense. But what are some of the strategies or approaches or experiences in not only identifying the win-win for the diverse stakeholders, but also communicating that win-win to different audiences? How do we get the people on board through framing the win-win, and then how do they communicate that externally? Kate.
Important things that one needs
Katie?
to do.
Oh.
It's important to know and appeal to the specific aim of each of the individual stakeholders. And it's important to flip the script, and rather than focus only on the shared holistic benefits, really understand and speak to and appeal to the win that each stakeholder will experience on this shared journey towards holistic success. So I think it's really imperative to not lose our stakeholders by jumping to the shared goal, but really hear from them what is their win towards the win-win, and appeal to that quite openly and honestly. We can get towards the win-win by emphasizing the real siloed wins that the stakeholders gain on their pathway towards prosperity and safety and health. So for example, when I'm talking with business leaders in Central America about engaging in multisectoral action, rather than appeal to corporate social responsibility and being a good corporate leader, I can also say, if you help us to invest by building the skills of your workforce, you will grow, you will be more competitive, they will have higher incomes, and they will then be able to purchase more nutritional food for their families. But I don't jump to, do you want to be part of a safe and prosperous community? Of course they do. So those are my two pieces of advice. Really focus on the individual win, because that is going to keep people coming to the table.
Makes sense.
And staying at the table.
Thanks, Katie. Joni, any thoughts on the experience with Active in nutrition that brings together health and entrepreneurship and agriculture? How has this been framed?
No, I mean, I think I really agree with a lot of what Katie just said about finding the win-win. To add to that, I think there's also an element of trust building, whether it's with our clients, our program participants, but also with other potential actors and stakeholders. I think we often forget within our silos, because we're so we understand each other's objectives so well already, that there are a lot of differences between different stakeholders, and that we don't always understand the potential opportunities as well, and we don't have that trust built in. And that's a process that takes time. And I think that, I often think about it as, an example of kind of, we don't necessarily know what's out there, and so we have to be good listeners. We would never expect a cruise liner to start doing rescue missions where they have to be going fast and speedy and turning around quickly. And yet I think often that's what we end up doing when we first jump into multisectoral actions, is kind of think about everybody as having the same skill sets and the same potentials, and not really realizing where the opportunities are to find something that's better fit for what our particular objective is.
Yeah, that makes sense. Thanks, Joni. Sayaka, any thoughts on public and private sectors and how to frame that win-win and communicate it to the different audiences?
Yeah, I think I think for various, speaking to what Katie was talking about, kind of messaging for specific stakeholders, it also has been really interesting in my experience to see how different stakeholders resonate with either kind of concrete data versus kind of more of that sentiment, like stories. And, it's not to say one is better than the other. Certainly, maybe a combination of the two can be the best. But when we think about these multisectoral actions between public and private sectors, I've always found that oftentimes at the foundation, there is this feeling of, zero-sum game, right? If you gain, I lose. And that's not the narrative that we want to maintain. And use of data has been really helpful for us. We've done some analysis around how engaging the private sector, taking market-based approaches or making room for market-based approaches can increase the family planning market with the same amount of resources that the government and donors have. It's just that you're pulling in more private resources to the table. And so by shifting the narrative with data to show, you see your market share or the number of people that you are serving remains almost the same. You might actually be serving more people at risk or harder to reach, which is actually most likely who you want to reach anyway as a government or a donor. Whereas the people who do have the ability or willingness to pay have the choice of accessing it through the private sector, through commercial markets and things like that. So and overall the pie is growing through that better collaboration. We've been able to show that in Uganda and a couple of other countries in sub-Saharan Africa. So I think it's been really critical to know when to use the data, have that data available. and kind of intertwine it with the right stories to speak to the right set of stakeholders, whether it's the businesses to invest in that, or for the government to know that by making room, they're actually making better use of their resources.
So it goes back to the old lesson, know your audience. Thanks, Sayaka. Another question has to do with kind of the perceived urgency for a particular issue can be a boon for MSAs, but often we're delving into issues that aren't perceived as urgent by high-level stakeholders. How can we continue to advance MSAs in the absence of perceived urgency? Clive, any thoughts on this?
Sure, thanks, Jay. I think as policy advocates, we are always looking at that policy window. We are so fond of that policy window, and agency might be one of the ways to open that. But I would also want to argue that for longer term sustainability, are we looking at making something appear urgent, or you want to mainstream the issue to become mainstream and you don't have to be making a case? I mean, we've seen, for instance, COVID underline the importance of cross-sectoral partnerships and collaboration. But I do think that, like I did mention in my remarks, the good thing is that most of the policy documents, the longer term strategies, recognize the links. So I think we have a continuous opportunity to make sure these issues are mainstreamed into national policy and programming, rather than waiting for that boon where they will show up as an urgent. And we should also ask ourselves, in such cases, if they were to come urgent, would that action be sustainable, or will it be just an action that will be catered for within an emergency setting, and that will end once that emergency or urgency is over, rather than having it mainstreamed as core development?
Thanks, Clive. Sayaka, any thoughts on this one?
Yeah, I do think that, the mention of these kind of crises, as Clive was mentioning, whether it's COVID or otherwise, can kind of shift the landscape, shift the narrative to motivate some of these partnerships. We certainly don't want to waste those opportunities. I think, riding on that and using those opportunities to lay the foundation for multisectoral action is really, really helpful. I've been doing a lot of work in Indonesia for the last several years, and prior to COVID, the government had already started thinking about establishing a policy framework and collaboration around public-private partnerships for health. So, there was already an initiative by the government that, this types of partnerships would be really helpful to mobilize resources and sustainably expand quality services. Certainly, COVID kind of put additional kind of push towards the need for that kind of collaboration. And what's really been helpful is that we've been able to find more and more examples of these pockets of partnerships that we can now showcase as kind of evidence that these partnerships work, that public and private sectors come together and can work together for mutual benefit. So what we're trying to do is to be able to showcase that as, countries, we're still certainly in that COVID crisis mode still, but as we shift towards more of a sustained response to the pandemic and future issues, trying to make sure that we don't forget about that, be able to showcase that and to use that as a lesson learned to scale up these types of partnership in the future.
Thanks, Sayaka. Let me jump to another quick question. Question is quick, but the answer may not be before we go into the Q&A session. Coordination across silos, both within and outside public and private sectors, can be challenging, even when everyone is committed to the MSA. Can you speak a bit about the difficulties in coordinating actors and what has worked to promote coordination? Allison, this is square center in front of you with governance and the engagement of stakeholders.
Yeah,
any thoughts on that?
Yeah, thanks, Jay. This is a really tricky question. I think this is one of those where, like, you see if where the rubber meets the road, right? But especially in decentralized contexts, when you're not just coordinating across national level ministries or national level corporations or organizations or what have you, and figuring out how to foster coordination throughout the system. And some of the key challenges that we've all experienced could be as simple as people not knowing roles or functions of other teams, offices, or ministries. And I mean, it seems simple, but even on this panel, I'm sure not all of us know what every other person in our own organizations does to advance our work, right? So it's not, if within our organizations, it's a challenge. Imagining within a whole health system or a whole government or what have you, the challenge is immense. And so really, people, teams, organizations, they may not know how to effectively communicate technically with experts and organizations. And that gets to some of that knowing your audience question, knowing what kind of evidence people want to see and use and what have you, points that Sayaka and Katie were making. In Senegal, the USAID funded Gold project, which is implemented by RTI, is using a variety of tools and approaches to sustainably address some of these coordination challenges. And it's a unique project in the fact that its mandate is to work across sectors to advance development outcomes, including health. And so Gold is developing capacity at the municipal and facility and community government levels in health planning, resource mobilization, and accountability. And this is across multiple health sectors, it's across different development sectors, and it's inclusive of the private sector. And so a primary platform for this collaboration at these lower levels in coordination becomes this municipal participatory planning and budgeting process. And then what really keeps people coming back to the table is that they're all getting something out of the collaboration. They are all seeing benefits come to them from their investment. And that's really kind of the kicker, is making sure that once you've got everyone there, working to make sure that everyone is getting what they need out of the relationship. And once people stop seeing that benefit, they start, dropping off.
Great, thanks. So I realized, we are into our question and answer time. And so we've gotten a couple of questions in the chat that have been forwarded to me. Let me share the first one with you. With the social and economic impact of COVID-19 likely to be felt by low and middle income countries for the next several years, how do these projects adapt their strategy for sustainability? Knowing that resources are stretched thin to respond to the pandemic. So how are some of the examples that we've shared today been adapting in the past year and a half as COVID has come online and continues to play out, in different parts of the world? I was just reading about Latin America this morning. So any thoughts on the adaptations to MSAs in the context that we've been talking about?
I can speak a bit on some of the experience that we've continued to have in Senegal, which is, they'd established these platforms or strengthened platforms earlier on in the project. And when COVID hit, those platforms actually became a really strong benefit for all of these stakeholders that all of a sudden were like, oh gosh, I don't have these connections. I don't know who to turn to. I don't know where to go, but I know that this platform exists. And so these platforms were actually strengthened by COVID because people were flocking to them, right? And so because they provided different opportunities for communication. And so I think opportunities like that, I think we'll continue to have to bring people in on that side and developing, demonstrating the value add of collaboration and connecting through COVID, right? Because one of the unique things about COVID is that it's felt across sectors, right? And so I don't see the task forces going away. I don't see new communication platforms going away. I think, adaptation gets into the, virtual meeting space and virtual capacity development and all those different things. So I think, that adaptation, I think, is really going to focus on things we've talked about already in terms of how do you develop evidence to communicate to other people? How do you speak other sectors' languages? How do you continue to negotiate? How do you continue to establish metrics? How do you continue to establish shared goals? So I think it's kind of gonna have to be that, you know, at a very elevated effort over the next several years. So those are my 4 cents.
Yeah, and the ability to pivot, because, you know, we talked about urgency. Something like COVID becomes, you know, it's not just the flavor du jour. It is much bigger than that. And the ability to take the structure that we have for coordination, expand when necessary, pivot. Some of the work in Guatemala with the youth organizations, kind of talking about messages, not just about reproductive health, but about COVID prevention and treatment and what we need to do to kind of keep things under control.
Maybe just to jump in here.
Okay, Joni, and then raise your hand if you had a quick comment. Okay, Joni and then Clive. Yeah.
Great. Yeah, I just wanted to jump in here. You know, here in Malawi, we're just starting to enter our 3rd wave, and I think this past year has been really interesting because we've seen a huge increase in these multisectoral actions, both within our project. You know, we have a radio program that focuses on messaging around helping people improve agriculture, and we've been using it for the past year to also share messages not just on COVID, but also on how to improve, how to stay safe when you go and market your crops at the market, to stay home if you're not feeling well, to send one member of the family instead of all members of the family. And then we've also seen a lot of opportunity to increase collaboration with the private sector, because of course, you know, while some of us are working from home, our private sector partners are out there every single day, regardless. And they're still in the field, they're still working in the communities. And again, this kind of goes back to the idea of our private sector partners are everything from the big multinational organizations to the individual entrepreneurs on the ground. And every single one of them has the ultimate goal of having enough food at home, having money at home for their basic needs. And COVID hasn't stopped that. So I think there are a lot more opportunities moving forward for this intersection of health and of private sector collaboration and other sectors as well.
Thanks, Joni. Clive, you wanted to comment on this.
Sure, I actually wanted to mention the kind of why COVID has made the development community adapt and appreciate the importance of resilience. And within USAID, we define resilience as the ability of people, households, communities, countries, and systems to mitigate, adapt to, and to recover from shocks and stresses in a manner that reduces chronic vulnerability and facilitates inclusive growth. It's clear that COVID is one of those shocks and stresses that hit every sector, and each of the sector is within health. We are talking about building resilience of health systems and interventions within the health sector that will build resilience. So I think being able to really think through the humanitarian to development continuum within COVID is a way that we are hoping that multisectoral action will be more meaningful more than ever. Thank you.
Thanks, Clive. So another question that's come in that may be more up for you, Clive. So how does the coordination occur within USAID? Is there actual co-funding for MSAs? Or does the FPRH team and the nutrition team put part funding in to cover the costs of MSA type work? Clive, any insights on that?
Yeah, true. I think one of the things we recognize is that for cross-sectoral, multi-sectoral action, one of the lessons that we've learned from many years of program is that funding from different sectors is always critical, and this is not within aid particularly, it's across the board, because we are talking about action even at the country level. Different ministries have different flavors of funding. We always get the comment that some parts of the government are more siloed in terms of funding or earmarked than the other, but I do say that that's not the case. Ask a Minister of Education to use some of their education funds in Uganda to support family planning, and I'm sure you'll have the same fight. So
yeah.
I do want to say that it's always good to show, and going back to what Alison said, you have to show what's in it for everyone. Why should I invest in that sector, or why should I care? It has to be that in most of the cases, I'm going to get better results for my sector. I'm going to get better outcomes. So, and that also goes to the question that, or the remark that we always get. If it's an issue around health, go to the health ministry. We know health is important, but the health ministry is the one that is they are the ones where the buck stops. But right now, I think even within aid, there are some programs, including the population environmental development work, where sometimes we have to use some of the POP funds to support cross-sectoral development. But increasingly, we are seeing interest and attention from every sector to work across other sectors and leverage funds from different sectors within their own mandates, but being able to make a case for cross-sectoral outcomes. And of course, that's where the role of champions is very critical. You have to be showing people and program managers and why it is important to think and consider programming other sectors, because ultimately they will get better development outcomes.
I would also think that from a USAID perspective, this type of thing makes more sense and is more easily facilitated through a bilateral, because you've got within the same context, the same, you can work with the ministries and really try to come up with this multi-sectoral way of advancing against a complex problem, kind of like what Joni's talked about with malnutrition in Malawi, as opposed to a global project that is a little more difficult because of the way the funding comes. But global projects can also be doing something where they get multiple funding streams in their field support. So let's see, at the country level, the coordination happens at the technical working group, and USAID usually has their partners represented in these TWGs. Thanks so much for that insight, because that is one of the ways that USAID influences the priorities and the implementation across the board. Folks, it's 9:48 or 9:58. We are just about out of time. This has been just a fantastic experience talking about working together between health and non-health, public and private, to advance solutions on some very complex and I'd say stubborn development challenges. The social issues we address through development programs, such as ending poverty, achieving universal health coverage, and reducing malnutrition, are complex. They're multicausal and multifaceted. And the issues we've considered in today's forum illustrate that multisectoral work embraces a diversity of ideas, actors, and approaches. Achieving improvements in health outcomes does not rely only on the availability of affordable quality services. In many ways, these services are the tip of the iceberg, and improved health is both a result of and a contributor to economic growth, which is why multisectoral actions create win-win opportunities for development. To achieve these successes, the broader health and development community should more proactively turn its attention to multisectoral actions, designing cross-sectoral interventions like Clive talked about, and building stronger collaborations, networks, and alliances that focus on common goals and bring success to all their members. I want to thank our participants today for sharing their insights and their experiences on different aspects of multisectoral actions. And I want to thank the audience for taking time from your busy day to join us, and hope that it's been a productive, fruitful hour for you. And of course, I want to thank USAID for supporting the Health Policy Plus project. This is part of the ongoing webinar and policy forum series, so we look forward to having you join us in the future for additional online events. Again, thanks so much. Have a good day.